Doing urine analysis and wet preps is a very underutilised activity in clinical practice, but it actually can give you so much information in a very short period of time, even in the time frame of a consult, or if it's an inpatient within a very short period of time, many, many hours and days before you get any results back from the external lab. It can tell you how concentrated that urine is. It can tell you whether there's evidence of a pyuria or white cells in the urine. It can tell you whether there's red blood cells, even with or without the presence of overt hematuria. So it gives you a really good opportunity to really make decisions at the time and very quickly for your patient. One of the things I think is probably the biggest asset for doing a wet prep and doing it at the time and in your practice, making sure that your clinicians are trained to do it, is to decide, do you have a bacteria? Do you have a urinary tract infection or don't you? And that's important for both dogs and cats. It can help you make decisions about whether to send a patient home with antimicrobial agents, whether to send the sample off for culture and susceptibility. And that's really the most important patient that is for is often our cats. We see urinary tract disease quite frequently in cats, yet a lot of those are not bacterial. And they would benefit much more from anxiolytics or pain relief or anti-inflammatories and not from antibiotics, because most of those are not going to be caused by bacteria. Wet prep will allow you to make a decision there and then as to whether there is bacteria present in that urine sample, and combined with the patient's clinical signs, allow you to make a decision right on the spot and move forward there. Just in case you're worried, no one is going to expect you to identify what bacteria is down there. You should know from your usual suspects who's likely to be in a urinary tract infection in, for example, a dog or cat. But when you look at the wet prep, you'll be able to determine whether there is or is not bacteria present. I can't always tell. I'm a microbiologist and I can't always tell what bacteria it is down there. So that's the end game for us, is to work out whether there is bacteria present or not. So you can decide whether you're going to treat, for example, a cat as a cat with urinary tract infection versus lower urinary tract disease, or what's now called feline idiopathic cystitis. The equipment that you need to do a urine prep is incredibly simple. There are very expensive machines that you can purchase now that will allow you to do urinalysis automatically in your practice, but really to do it simply and cheaply, all you need is the urine itself, a glass slide, a cover slip, pencil for labelling the slide, and something usually sterile to transfer the urine to the slide. You've got to remember that this urine might be something that you want ultimately to send for culture and susceptibility, so you don't want to contaminate that in the process of creating this urine slide. One of the most important things, of course, apart from colour and consistency, is to see whether the urine is actually turbid. So if it's turbid and you can see particulate matter floating around, then you don't need to centrifuge it to look at it with the urine wet prep. If it is fairly clear, and particularly if it's dilute, you actually need to centrifuge it. So most clinics have some kind of centrifuge, and in our laboratory, we usually take a couple of mils of the urine and we spin it down just for a minute or so. And then when it's spun down, you pick up the tube and you decanter, meaning that you literally pour out the excess. And what you're usually left with is that little bit at the bottom there. If you resuspend the pellet in that amount, that's going to give you the perfect consistency for looking at a more concentrated urine prep. So if it's turbid, don't centrifuge it. If it's very clear or if it's very dilute, then centrifuge it. That maximises your chance of actually seeing all the elements in the urine that you need to see. So using either your centrifuged sample or your neat sample, make sure that you use a sterile syringe, or in this case I'm using a sterile transfer pipette, to take a bit of urine. I don't want to contaminate this urine just in case I want to send it off to the lab for culture and susceptibility testing. And all I need to do is to place 2 drops of the urine onto the centre of my slide. And I want to make sure that I throw away this urine into a contaminated waste bin. I don't want to put it on the table because I don't want, if there are any organisms, any multi-drug resistant organisms or leptospirosis, I don't want that to be contaminating my environment. In our lab, we have larger cover slips. Some people in many practices just have the 1 centimetre square or 2 centimetre square ones. So you just pop the cover slip over the top and then you're ready to go. If you put too much urine on there, it will flow over the edges. So I would recommend for the 1 centimetre square cover slips just to put 1 drop. If you've got slightly longer cover slips like I do, then you need to just put 2 drops on there. Before we look at this under the microscope and set it up for the microscope, just bear in mind this is a fluid medium underneath the cover slip. And so when you're going to be focusing the microscope onto the slide, you need to actually move up and down to look through that fluid medium, unlike a cyto slide or a histo slide where you get to focus and you stay there. This is a medium where you actually want to be moving up and down so you can see all the exciting things that are there and present in your urine. One of the important aspects of urine preparation is actually getting your microscope right. A couple of features. The first thing is to focus, in the first instance, on the edge of the cover slip. That'll help you at least start off on one plane of field that's in focus. Remember again, as you look around the slide, you'll be actually going up and down to look at the depth of the fluid media that's present there. The second thing that's really important is that you need mood lighting. So this is not something where the light gets beamed through the urine. You need actually the light to be much more subtle. And there's 2 aspects to that. You do need to turn the light down. And the other element is to take the condenser. The condenser that is usually in most microscopes here just under the platform. And you need to use usually a knob on the left-hand side to take that condenser down away from the slide and the platform. So what that does, by reducing the condenser away from the platform, is it changes the way light refracts off the different elements in the urine. So it's going to make the crystals stand out and differentiate from the white cells and stand out from the red blood cells and the bacteria. And you'll see that as we have a look at it under the microscope. So just the last thing is, this is, even though we are often interested in whether we've got a bacteria or not, so we're looking for bacteria, you don't actually need to use 100 times and you don't need to use oil immersion. You can start off at 20 times, focusing on the edge of the cover slip, as we said before. And the maximum that you would need to go down in terms of objectives would be 40 times. When bacteria are in a liquid medium like urine, they're actually much bigger, much fatter than when you gram stain them and you look at them under the microscope. Once you've set up your microscope with the condenser down and the mood lighting on, and you've focused on the edge of the cover slip, you can then move into the body of the cover slip and have a really good look at your urine. You do need to spend several minutes having a look quite systematically up and down the slide, as you would with a hematology slide. And every time you stop to look at one particular area, remember to go up and down with the fine focus so that you can go through the depth of that urine to look at the different elements that are there, rather than just staying on that one plane. And just finally, it's really important that you're seated if you're going to be looking down a microscope, not just for your back, but also so that you can spend a bit of time, be at the right angle with the microscope and have a look around under the microscope there. One of the first things you want to do once you get your slide up onto the microscope platform is to focus it on the edge of the cover slip. So you can see here, this is the edge of the cover slip, and you've probably got an indication on the left-hand side here. You've got your urine, and you've got a few escapes, so there must be a little bit of urine popping out of that. So if I just focus on that a little bit and come down to the correct plane of field, you can see that I'm kind of in the right area now. So I can start moving my platform along so that I can make an assessment of what I'm seeing here in the urine. One of the key things, I guess, that stands out from the very beginning are these large numbers of white blood cells. And I can tell that they're white blood cells. They're reasonably big in size. I can appreciate that they've got a bit of a nucleus present there. In a moment, I'll point out the red blood cells, which of course are a little bit smaller and will have no nucleus in this area of kind of central dipping. The other thing that's really obvious out in the background here is these bacteria. And you know that they're not kind of bits of fluff or something else because they've got their own motion. They're moving in different directions. We might be lucky, there might be one over here who's dancing to their own beat. We've got these ones who are kind of actively moving in one direction. And you can see that they're probably rods. I don't think they're chains of cocci. But the key thing is not to really try and determine what organisms you have down there, but the fact that you have organisms down there of bacterial size and that you've got white blood cells there. So that really gives you an indication, along with clinical signs, that this is a true bacterial infection of the urinary tract and that you need to proceed with treatment. So if I move up and down here, it helps me differentiate an object like a crystal from a cellular structure like a white cell. Over on the left-hand side here, I think that's probably either a bladder epithelial cell or a conglomeration of white cells. It's a little bit hard to tell. So you'll see here and also up there these highly refractile objects, and this is why going up and down with the focus is going to give you a bit of information. So it remains, if you focus on this object here, it remains very spherical and very highly refractile. So this is highly likely to be lipid in origin. It just got kind of had a drive-by by one of the bacteria there. And if we move over to this area here, and I go up and down with the focus, I can see this is actually lots and lots of bacteria in the centre here. So this is all done at 40 times. So you don't, when bacteria are in a liquid medium like this, they actually are much fatter and larger. They're probably even 5 to 10 times larger, and they don't need 100 times, and you don't need oil immersion. So this is just as we did before, a glass slide, cover slip with the urine underneath it, and all at 40 times. You can start off at 20 times and go down, but I must admit I usually like to see things quite large quite quickly, so I usually start at 40 times. If I look at this cell up the top here, it's very clearly a white cell. I can see the nucleus there, and I can see that it's the correct size for a white cell. If I compare that to this one over here, again, it's not hyperreflectile, so it's not going to be like a fat globule or an air bubble. It's actually likely to be a red blood cell there. In terms of trying to decipher, the morphology of the particular white cell, it's not. You probably need to go to a dry, quick stained object to actually look at those things. So when we're looking at a wet prep, the key things, takeaway messages that you want to answer very quickly in clinical practice without have to going through staining or anything else is, are there bacteria present? And in this sample, there's clearly lots of bacteria present. And the second one is, are there actually white cells? Do you have a pyuria? And the answer to this particular case is absolutely. You've got lots of white blood cells here in this particular picture. And you also might want to look for crystals and other things. Now that's a bit controversial, the significance of those. If you also have a urolith, it might indicate what type of urolith that is, but those two things don't always marry up. So one of the things that people do worry about is things they can't identify. So elements like this in here, which is a degenerated something, that could be the epithelium of the bladder wall or the urethra, or it could be a destroyed white cell. Those things are not that important. your important structures are your white blood cells, your red blood cells, your bacteria, and in some cases, casts. But in a true bacterial infection like this, your white cells are always going to be a little bit unhappy. They're going to be degenerate. They've gone in here to fight the infection. They've gone in here to die. So they're never going to look as beautiful and pristine as a blood smear. So when I'm looking for the bacteria, I guess the first question, is there bacteria present and are they there in large numbers? In this case, and this is an uncentrifuged sample, they are obviously here in very large numbers and they're still alive. They would appear to be rods, although some of them appear really short. So there's this little one over on the side here who's got an appointment off the edge here. It's just running off in its own direction there. So I can't really tell by the size of it whether that's actually a cocci or not. So really, it's with 20% of infections being dual infections with something else, the decision here is not what bacteria do I have here, but do I have bacteria? And do I have it in combination with white cells to make me think I have a true urinary tract infection and I need to, in light of the animal's clinical signs, I need to move forward with some kind of treatment. See, that's a really hard thing because even things like E. coli, which I think this is what this is actually, will be quite what's called pleomorphic. Some will be really short and some will be super long. Occasionally when we look at these, you can actually see that they are chains of cocci, which, based on probability, make them much more likely to be Enterococcus, which is in our top 5 usual suspects. Certainly, the older the sample is, the less white blood cells will be there because they've come in here to fight a fight and they usually die over time. The bacteria in these, because they're usually quite resilient bacteria, will actually survive for quite some time. So when we're preparing them for student classes, we can have a urine submission that was several days old and the organisms will still be dancing across the screen like some of these are. So this particular sample is 48 hours old, yet these organisms are still very mobile. So it's the other cells around it that you lose with an older sample. So there will be times where you look at the sample and you may just see red blood cells and you won't see any bacteria at all. And so that might occur in a case of a cat, for example, with feline idiopathic cystitis. And so that may be the signal to you not to treat it with antibiotics, given that 90 to 95% of them are not bacterial, except in older cats. It may be a signal for you to actually use other measures to control the cat's feline idiopathic cystitis, like anti-inflammatories or anxiolytics or other things that help the cat relax. So if you're looking at a fresh sample and you can see bacteria present there, and by fresh I mean you've really made this wet prep within a couple of hours, you can see bacteria there, you've collected it in a way that is aseptic, and you don't see white cells at all, then it's very likely to be an asymptomatic bacteria. And the thinking now is that those ones should not be treated if there are no white cells present, unless the animal is on chemotherapy or something like that. And there's another reason why they don't have white cells coming in. So there's this whole philosophy now around occult or hidden asymptomatic bacteria in both human medicine, canine medicine, and also feline medicine, where in human medicine they don't treat them. So this is the problem, I guess. If you don't actually have your urine looked at and you look for white cells and you just send something off for culture, then usually the lab actually will look for the white cells and red blood cells and the bacteria there. But if you're just doing it without, if you're just culturing without actually looking at the urine, you're not fulfilling that criteria of, does the animal have some clinical signs associated with urinary tract disease? Does it have white cells present? And does it have a bacteria? Meaning that you actually have a true urinary tract infection as opposed to asymptomatic bacteria. So one of the advantages of doing a wet prep like this one here is you get to see the number of white cells and the bacteria as soon as it comes out of the animal. The longer and older the sample is, the more white cells may disappear from this slide, so the lab might not be able to pick up as many. And they'll still see the bacteria there. The bacteria will be present, and as long as you just keep it refrigerated, they won't usually be a problem. But it's the deterioration of these already degenerating white cells who've gone in there to fight the bacterial infection, and sometimes will pop and be destroyed over time. So the best way to get that snapshot of what's happening at the animal right at that level that you took the sample is to do one of these wet preps, and it gives you the perfect information to be able to make that on-the-spot clinical decision. Is this a true bacterial infection? Do I need to send it off for culture, or do I need to treat with antibiotics? Versus there are just red blood cells here, there are no bacteria here, for example, and I need to think about another cause, or treat with another kind of modality other than antibiotics. So it's a good decision maker as to antibiotics or no antibiotics when you're thinking about treating these kinds of things. So part of our work up in the lab will always be to do both a quick wet prep and then also to do a dry prep, which you can either make up at the same time. You can either just put a drop of urine, dry it off, and then stain it with Diff Quick or gram stain, or you can look at take the one from the wet prep here once you've finished, take the cover slip off and make the dry prep from there. The reason why you might do that is if you've seen some cells under here that you think might be not white cells, but they might be neoplastic, so they're large and they're clumped together and they look a bit abnormal. They would be the ones obviously that you'd want the external laboratory to look at also, but you may be able to pick up transitional cell carcinomas, exfoliated and things like that, and that's better done through a dry prep with Diff Quick. If I can see bacteria present here, and I can tell that they're present there because they're mobile, and that's actually much easier than actually looking at a dry prep. When you look at a dry prep, because all these organisms are going to be different shapes and sizes, even if they're the one species, E. coli can be really short or really long, and so sometimes people get confused. When they're moving around on the slide, you know that they're bacteria. If you go to the next step and do a dry prep and perhaps do a gram stain, then you're able to actually see that they are gram-negative rods and confirm in your head the next treatment moving forward from there. Or you may decide that it's time for a culture of the sample. It really depends on the clinical condition of the animal and whether this is an acute bacterial cystitis, so something that's just occurred immediately, a sporadic bacterial cystitis, or whether this is a recurrent one that you need to really confirm what's going on. If you've got any signs of pyelonephritis, like fever, malaise, plus or minus pain around the kidneys, then you're definitely sending this off for culture. You're confirming that you've got bacteria here, you're going the first step of putting the animal on to antibiotics, and you're getting a culture because you actually really want to know what these organisms are susceptible to.